Hello, my name is Connie Lee Montgomery. I am the Epic Global Patient Advocate, coming here today to talk with you about strokes. Yes, strokes. Strokes has affected my family personally. In March of 2020, my oldest sibling had two strokes back to back. And let me tell you, that changed the entire dynamics of my entire family from that point forward. And it absolutely altered and changed my sister, Jackie Montgomery's life. But today I'm here because I'd like to personally thank Dr. Christine Cosby Gaither for bringing our awareness to National Black Stroke Awareness Day, which will be May 18th, 2026. Thank you so much for making this day a national day so that we can pay closer attention to our numbers that affect us in the Black community regarding strokes. And the numbers I'm speaking of are numbers like our high blood pressure numbers or hypertension, some healthcare professionals call it, knowing the top number and the bottom number, systolic and diastolic numbers. Also knowing our heart rate, whether we're having an irregular heart rate or not, arrhythmias or not. All of this is very important, as well as knowing if we are diabetic or if we're living with chronic kidney disease. All of these things contribute to having strokes, or we are individuals living under a lot of stress or pressures. In the Black African American community, we have undergone so much in Western medicine. And a lot of times we've been dismissed or not heard or not listened to fully. But it is up to us to advocate for the best health for ourselves. And the best way we can do that is to know our own numbers, our blood pressure numbers, our pulse rate, our heart rate, know all these types of numbers that affect us. Know our A1C, that is your 3-month accumulated numbers of your blood glucose levels. Yes, know that, because knowing this information will help you help others help you. Now, let's talk a little bit about symptoms of stroke. What are some of these symptoms of stroke? If you are having balance or coordination issues, that may signal to you something is going on. If you suddenly have vision changes or your ability to be able to see clearly, that may be an indicator something is happening. Or if you see sort of what we call a face drooping or an asymmetry in your face where one side looks higher or lower than the other, that also may be an indicator that something else is happening. What about experiencing arm weakness? That also may be a sign that something is going awry. And speech difficulties or speech impediments might start to occur. You may start to slur your words. That is an indicator or sign of stroke. It is time then to call 911. And there is a little saying we have to help us remember this information. Be fast. The B is for balance loss. The E is for eye changes or vision changes. The F is for face drooping. The A is for arm weakness. The S is for speech difficulty. And the T is for time to call 911. So know your signs of stroke. And this is so important because Black Americans have a higher occurrence of stroke and a higher death rate from stroke than any other racial group. We can do something about this. So on May 18th, 2026, let's help Dr. Christine Cosby Gaither make Black Stroke Awareness Day a national campaign where everybody is talking about it, as well as wear your red and your black colors in honor of the day. Thank you so much. I am, again, Connie Lee Montgomery, your Epic Global Patient Advocate. And today is May the 15th, 2026. I'm looking for you and counting on each of you to tell someone about strokes on May 18th, which will be our National Black Stroke Awareness Day. Thank you so much.